Well, hello, and thank you for joining me today. I've got a special guest coming from Los Angeles, California, and we're here to discuss the connection between hormone imbalances and issues in the mouth. So, how oral health connects to our hormones. It's a really big topic, actually, and it doesn't get as much airwaves really as it deserves. And so, I'm really excited to jump into this topic with Dr. Leedia Riman. Thank you, Dr. Leedia, for joining me.
Thank you for having me.
Now, we were diving a little bit into your story in backstage, and it's so interesting, this hormone connection to gums and oral health and fertility and pregnancy, having children. Where did you start to think differently? You're a practicing dentist in Los Angeles. When did you start thinking differently about how hormones affect oral health, your patients, and also yourself?
Great question. So at the beginning, it wasn't a hormone thing for me. Like that wasn't even, they don't teach you this in dental school, like at all. So I got a job in Aramco, Saudi Aramco. It's an oil company in Saudi Arabia. And I was seeing most of the women and a lot of the expats there. So, I was seeing the women, and because I speak Arabic, I was talking to them, and then their teeth were destroyed. Like I couldn't connect. Yeah, there's a lot of diabetes and there's a lot of health problems, but then I just kept thinking. I was working there for about 3 years, and I was like, why do they have such bad teeth? They have a lot of children, and oral health isn't like a primary thing that they talk about. I didn't make the hormone connection at all back then. I wasn't married. I didn't have a baby. It wasn't until I got pregnant and I'm like, oh my God, there's a connection here because I had hyperemesis gravidarum when I was pregnant with my first daughter, and I was vomiting between 7 and 14 times a day every day for 8 months straight. So I didn't recognize myself, and my oral health, even as a dentist, was last priority. And then I hit a very low point in my life, and I was like, why is this? And I lost a front tooth. I have an implant. It got infected, and I was getting cleanings every single month by my brother, who's a dentist, like literally every single month because I couldn't get a toothbrush in my mouth. I hated mint. Like a lot changes when a woman gets pregnant. So after I had my baby and everything was fine and dandy, I was in a really dark place, and I was like, there's got to be a reason for all of this. Why is this happening to my mouth? And there's like a huge emotional and mental connection to all of this as well. And then one night on Facebook, I posted in LA Mommies group, this is what's happening to me. Like my gums are inflamed. Like I don't feel good, blah, blah. And in like 3 hours, I got like 150 responses, and I dug deeper, and like over 65% of pregnant women have some sort of dental disease go on during or soon after their pregnancy. Some are reversible, but a lot are irreversible. And 65% is a big number. So that's when I started getting into the hormone effect of everything.
It really is a big number, and I'm seeing it so often now in terms of what women are experiencing both during pregnancy and then postpartum as a result. And they're really, there's a little bit of awareness out there, but they're really, I think like what you're speaking to is that there's a much bigger problem happening that women aren't perhaps educated and supported on. Well, since you've experienced this, have you gone back and thought about, what was kind of some of the causes as to why you experienced your presentation during pregnancy with your oral health? What did you find?
For sure. So vaginal tissue is very similar to oral tissue. We have the same receptors in our vaginal tissue as we have in our oral tissue. So estrogen and progesterone receptors are located on both sides, and they're located in the oral mucosa, in the salivary glands, and the periodontal ligament. So these receptors and hormones don't discriminate. And unlike old way of like conventional dentistry, you just feel like the mouth is cut off from the body and you just treat the mouth. And it's not the case because our hormones go everywhere. And anywhere there's a hormone receptor, they're going to go. So we have estrogen receptors in our mouth. And for example, during my pregnancy, any woman's pregnancy, you have a surge in estrogen and progesterone. You start going crazy, these hormones. And when you aren't aware of that, and I wasn't aware at all during my pregnancy, and I'm a practitioner, and that's what caught me by surprise. Like, if I don't know this, most of the women in the world don't know this because this is my field. It causes a lot of blood flow to come to your gums and gets you very sensitive to plaque, like plaque that is normal on my mouth and in my mouth and your mouth right now. It would cause exaggerated response to that plaque, leading to gingivitis, and that gingivitis isn't put in check early on, and that infection travels to the bone, leading to periodontitis. And there you go, your mouth becomes a focal infection for the rest of your body because it's all connected. Then it messes up your oral microbiome, and then we know that that's connected to your gut. So that's with regards to the estrogen. Progesterone, same thing. And progesterone causes deep fatigue in women. So when you're fatigued, your hygiene is going to go haywire. My hygiene went haywire. If I didn't have my brother, like, I'm blessed that I could get dental cleanings every single month, or I would have ended up with many cavities and periodontal disease. And then for pregnancy, I'm kind of covering pregnancy initially, but there's also a hormone called renulin that prepares a woman's joints, especially her ligaments, to give birth naturally. And we need renulin to be able to have a natural birth. Well, that hormone loosens up your ligaments, and we need that, or else we'd be in a lot more pain. Thank God for renulin. But there are renulin receptors around our periodontal ligaments around our teeth. And when these receptors are also activated by the renulin produced in pregnancy, our teeth can begin to shift. And I see a lot of women who come to me, it's like, Lydia, oh my God, my teeth shifted. And like 4 pregnancies later, they need braces to reshift their teeth back. So I'm seeing the renulin effect big time as well in pregnant women.
Yeah, that's an interesting one, isn't it? I've always wondered why those receptors are there. I guess because it's for growth and development,
Yeah.
and maybe for when there needs to be movement in certain situations. Yeah, but it's interesting that talking about teeth movement during pregnancy. What are some of the other really common presentations and symptoms you're seeing that pregnant women are coming to you experiencing in terms of their dental health?
I'm also seeing a lot of TMD problems. So the estrogen receptor. So a lot of the pregnant, so we're getting, as a whole, women are getting pregnant a little later in life. A lot of them are getting on birth control a lot earlier in life. And I'm finding that the both of those are impacting the joints. What do I mean by that? When you're on birth control, the duration that you're on really matters, because what happens is that your body starts getting used to an infusion of external estrogen or progesterone, or either both, depending on the birth control that you're on. That tells your body, hey, I'm getting hormones from out here. Your natural estrogen and progesterone, especially estrogen, decreases because it's been primed that it's going to be getting pharmaceutical estrogen or from the outside. And that they're finding studies, and I'm even seeing it in my patients, that is impacting the TMJ and causing TMD, which is temporomandibular disorders. And then comes pregnancy after they get off the birth control. It's very stressful to be pregnant. Some people have very beautiful pregnancies. I didn't. I had a very, very stressful pregnancy with all the nausea and vomiting. It's not easy. It's a real life change. It completely, I'm sure as a father too, your life is rocked upside down, but a woman is like on another level. So grinding and clenching are at an all-time high, especially recently in the past year to year and a half with everything that's happening also around the world. So it's so multifactorial what I'm seeing, but the estrogen plays a huge factor.
Absolutely, and we're talking about all of these structures in the mouth, and that are so responsive to hormones. We're talking about critical what we see as reproductive hormones, but there's a lot more roles for these that the body uses these hormones for. And you mentioned bacteria and how bacteria change with hormones and how the body is responding to hormonal changes and vice versa. And so, when we consider our preconception oral health, it really is a very complex picture as to what's happening, isn't it? It's quite amazing. I really think we're going to be very focused on what both bacteria and hormones are doing when we're considering oral health in the future. Now, we've talked a little bit about the presentation. I want to go back into pregnancy with you, but I like the idea that these changes are happening all the time, and it seems like women especially are experiencing these issues every month. And so, how does the menstrual cycle in your experience affect oral health, and what are the potential changes and effects with the birth control pill?
100%. Great question. So let's back up just a little more to puberty. So girls are getting their periods a little earlier these days, around between 11 to 14. Just back to basics. They're in middle school. I'm going to talk about the American diet here, because that's what I know. I mean, I have lived overseas and all over, but that's what I focus on here. So their diet and isn't up. It's not the best diet here. Cafeteria food isn't the best food. So they have a lot of simple carbohydrates that don't help their cause, starting with the diet. And then they get their periods and they're going through a lot of emotional changes during that time. So the gingivitis in girls that are going through puberty is at an all-time high. And it's not just the estrogen. So yeah, there's a hike in estrogen and progesterone. So that's one aspect of the equation. And the estrogen, like I said, stimulates a heavy blood flow to the gums. But also a lot of these kids in high school here are getting braces at that time as well. And I'm finding the poor oral hygiene from the braces, the poor diet, and their periods, and the lack of awareness about how all of this fits in the equation. Swollen gums, lots of bleeding, and there isn't a heavy importance about the importance of good oral hygiene and visiting their dentist. And then one last thing, insurance companies, they cover dental cleanings only twice a year. And I feel that when a woman starts menstruating at the beginning of that first hormonal surge, they should be getting cleanings every 2 to 3 months at the beginning, and then every 3 to 4 months after they stabilize. And that's a change that I'm making for all the women in my practice, and it's helping them significantly.
That's a great point, because the adolescent, the effects of adolescence on gum health, really, it's something that I'm observing as well. And if we think about the flow-on effect, if we have these issues during adolescence, and then when we're conceiving, maybe when we're even into our 30s, these problems really do stick around. And I think if we start seeing them in this long lead up to what happens during pregnancy, it really is a cycle that we're connected into all the time. What about menstruation? Because there is some evidence to show that there are periodontal changes during the monthly cycle. How do you manage this with your patients, and what do you observe?
So I always ask my patients about their menstrual cycles and if they're regular or irregular. I'm finding that women with irregular menstrual cycles get more of these periodontal changes and have more trouble keeping that bleeding in check. For my women who have regular menstrual cycles every 27 to 28 days, usually the bleeding, that excessive bleeding, does resolve within 2 to 3 days. I educate them about their oral hygiene, and we bring them in a little more at the beginning of their life. One thing I am finding is that too, when menstrual cycle starts, they do get more canker sores. And that high level of estrogen, I think there's a external stress when you get your period as a woman. I can attest to that. A lot of cultures don't talk to women about what a period is. It's kind of like a shock to women. And I kind of went through that. So I'm making sure I'll do a little differently with my girls, but girls should be taught very openly and in a gentle manner about what their period is. And it does affect everything with regard, and then telling them about their oral health and why that's important and how it can make their gums bleed a lot more. But it does resolve better in women that have regular menstrual cycles. The women that aren't very regular, I do bring in more often just to make sure that the gingivitis that they're encountering doesn't get out of whack and go to periodontitis, and then that's irreversible.
It's a great point. If we could connect these two things in, a young woman's life, it would really kind of help smooth out that transition for them and help them see that this process as they grow and develop really is connected. And the signs you can see in the mouth, I think that would be a very useful way that we could view this and help to educate young and
Yeah.
developing women. It makes total sense. And then and the points we're going to get into is perhaps we would be getting to prevent some of the issues that do happen when a woman is trying to conceive.
Yes.
Now, you've got two children.
I have two girls. Yeah.
How old are they?
5 and 2, Julia and Joy. So yeah.
And so the journey of being a parent, I imagine, has really kind of shaped your kind of view of how you see patients, but also to what you've experienced with them. Tell us about how your worldview changed as a parent.
Oh gosh, I mean, upside down, inside out. I'm sure you too, right? You have one baby?
I've got 3.
Oh, 3? Oh my God, bless your wife's heart. Bless your heart. I'm
We've
like,
got
I
3
don't know
under
how to
3,
ever
yes.
be. Well, 3 is a nice number because my siblings and I are 3. But it definitely, like, it shifted everything because, so like I said, when I was in Aramco, like a red light kind of came up. It's like, why am I seeing a lot more disease in women than men? Like, yeah, we do go through more, but I didn't connect that. And then I got married and I had a really hard pregnancy the first time around, but I didn't really, I'd like to say, awaken because I was practicing conventional dentistry till then. And I felt like we have to do better. There's something different that we need to do. And then Julia got very sick when she was 1 year old. She almost suffocated on her mucus and we had to take her to the ICU and we were in the hospital for 9 days. And thank God everything is fine. But I saw a lot of sick kids. And you're a parent, you don't like to see your kids sick. Like the worst thing that can happen to a parent is to see their sick kid. Like even if they have the flu or the cold, you're like, oh, I just want them to get better and start like bothering me again with all their questions. Like, so I'm like, what can I do for these kids? And I kept on searching and searching and searching. And she was mouth breathing at the time. So she developed reactive airway disease and stopped nasal breathing and started mouth breathing. And that's when I got into this dog and pony show. So I had like read your book and a bunch of other things. And I'm like, oh my God, there's like a different, it's like a whole different approach, a new dental school out there that like I was infusing on myself. And then I started, and then after Julia got sick, I'm like, how can I help children? It's through focusing on the women because the women are producing these children through their bodies. Of course, I mean, not the women alone, but it's through the women that the children are coming to the world physically. And the women, once the women get their oral hygiene in check, they won't be passing all that disease and bacteria to the baby in utero, in vitro, in utero, sorry, not in vitro, in utero and after delivery as well. So that's when everything shifted after Julia got sick and I started really getting into the functional biologic world and focusing on women. And then things started clicking. It's funny. Pieces of the puzzle started coming together. Like I'd get menopausal patients. I'm like, oh my God, that's why. I'd get like pregnancy, like major shift in a woman's mouth that's had 5 children because of the Rillianins. And I'd be able to talk to them and tell them, they're like, oh my God, no one's ever like explained this to me. Like I always felt something was wrong, but I didn't know why. And I was explaining things to them that just like was flowing in me and everything just started clicking and making sense.
Yeah, when you really kind of shift your perspective like that, it just comes to you, doesn't it? It's amazing how the clinical experience is shifted by your personal experience, and then it's just it's in every single patient. It's amazing when that kind of change happens, and you just think, what on earth was I doing before? It's
yeah.
Now there's a question that's come up here. I want to bring up a part of it. Jess asks, she's noted some changes in her teeth during pregnancy, and she says 2 pregnancies later, I'm seeing that my teeth are going see-through, and that she's perhaps deficient. Have you observed this, and how do you approach this with your patients?
Bring back teeth minor. There is a heavy demineralization in pregnant women, for it's so multifactorial. There's morning sickness during your first trimester, or for me, it was during all 3 trimesters. So there's one. As a woman's getting bigger, there's acid reflux going up. I don't think there's enough education and emphasis by medical doctors to women going to see their dentist during pregnancy. There's an old myth still, a tooth per pregnancy, and that it's unsafe to see your dentist, but it's completely safe and recommended to see your dentist not only once but twice because of that constant acidity. And what do we eat when we get nauseous to keep things in check? It's definitely, for me, it was more of the crackers, and you're waking up at night and you're snacking throughout the day. Some women, like I have a friend that just snacked on Sour Patches. Like my first pregnancy was very unhealthy until and I'm a dentist. So the snacking goes array, like all over the place. Luckily, I ate a lot of chicken liver growing up, so I had a lot of K2. As you were like, when you were like talking about that, I'm like, yeah. And I feed my daughter's chicken liver, and my gynecologist never told me about the importance of K2, and it's so important because you need that to uptake the calcium, or else your baby's leaching everything from you. And then also your fatigue. Like I was fatigued. There were some nights I couldn't brush or floss. And I was very sensitive to brushing as well. I started using a baby toothbrush because using a regular toothbrush would make me gag. And so many pregnant women that are my patients are like, oh my God, I wish I knew about the baby toothbrush because it really makes a difference. So you're having a lot of acid influxes into your mouth and not enough proper vitamins to remineralize, and your diet is not proper, and you think it's not safe to visit the dentist during that time, and then your teeth start like it starts getting thinner and thinner, your enamel. So that's in a nutshell. You're on mute. I can't hear you.
Apologies there.
Yeah.
Yeah, and it really is a multifactorial problem there, where there's a lot of lead up towards what your body is storing. Having chicken liver as a child is a huge factor. It's great you're giving it to your kids now, and you grew up on that. But yes, I'm just finding that a lot of postpartum patients really are, there's a long path, and they have to start, kind of starting with the foundations, and it is slow because you've just created a human, so it really does take some time for the body to rebuild. You have to restore these nutrients, and changing your habits in these ways, it's quite challenging. And the other thing too is you're dealing with young children, right? And so the sleep oh big point. And even during pregnancy, the challenge, both physiologically when growing the child, when the child is getting bigger and pushing the space of which your lungs have to expand into. How did you find the breathing aspect of pregnancy, and how this affected both your sleep and your oral health?
Sleep deprivation was really real, and like I would be gasping for air as if somebody was suffocating me. So I wasn't getting the proper oxygen that I needed, or the nitrous oxide that I needed, because I wasn't breathing properly. I wasn't going to deep sleep, where that's when you get that the detoxification of everything that needs to get out in your body. So that definitely impacts women on another level. And like you said, when you have a toddler or an infant and you're pregnant, and whether you're sleep training or you're co-sleeping, like everybody's situation is so different, but it really impacts your breathing. Like you're not breathing properly. So I always recommend my patients to breathe through one nostril and out. Like we do breathing exercises. We use essential oils a lot to just help with the relaxation. I started doing Wim Hof breathing. I'd like put his videos on, and just for 10 minutes, do the heavy breathing. So I actually started consciously breathing for the first time in my life once I was pregnant, because I was gasping for that air. And now I talk to my patients about it. They're like, "Oh, my dentist has never talked to me about this," but it's so, 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 so important. And then proper tongue positioning as well for proper breathing. I work with a myofunctional therapist here. So even for adults, we have to retrain ourselves, and pregnancy puts a huge stress on a foundation that isn't 100%, but it can be fixed. You just have to keep talking about it. And I want to make a note here. This is so important because there was a research study done here that only 3% of medical professionals talk to their patients about things like this. And I want to make a link with gynecologists and dentists because that's such, I already started outreaching here locally, but it's so important to make that link because they see the gynecologist a lot more than they see us. And if the gynecologist is emphasizing this and emphasizing the oral health aspect, ultimately it's the best for the patient and for their baby, short and long term.
Yeah, I love that. I love that connection. And if there was a nice link there between obstetricians and pediatricians, the circle really would kind of complete, right?
Come full circle, exactly.
Yeah, and it's so true that there is a lack of support in this whole area.
Yeah.
Where do you feel okay? So there's a lot of women suffering these issues out in the community. What professionals are they going to, and what kind of information are they getting back? So you're saying not many are talking about this kind of information. What kind of information are they getting, and what would you suggest to people out there looking for more to find out how to dive deeper?
That's a great question. I think, I'm just going to say my professional and personal, when I was pregnant with Julia, it was always about the baby. I think there needs to, I think our gynecologists and even pediatricians, when they see pregnant women with their babies, I think there needs to be more talk about how a woman's oral health is very connected to her baby and her overall well-being. Because if only 3% of medical practitioners are talking about this, that's way too little. That's just way too. They're talking about the health of the baby and the heartbeat, and of course, we want to have a healthy heartbeat and we want to have a healthy baby, or else, of course, that's primary. But we also want to have a healthy mom because that impacts the mental state of the mother. I'm getting mothers who have come after 1, 2, 3 pregnancies with 7 to 10 cavities. I had a friend, she flew in from Canada because she needed a root canal. She developed a sudden abscess during her second pregnancy. So there needs to be more awareness. There needs to be more talk about this from the medical professionals. And it's up to us dentists to start making noise. And I'm so grateful you're doing that, because when another medical professional hears this, they'll be like, oh, okay, oh my God, especially a functional medical professional. And then it just starts getting into the medical world a little better. But they're talking general baby health, but they're not talking about why vitamin K2 is important, why oral hygiene is very important during pregnancy. And if you can't do proper oral hygiene because you're too tired and fatigued and you're depleted, why you need to see a dentist that will take care of you and educate you.
Yeah, it makes so much sense. And, the amount of new mothers out there experiencing that very situation, it really does kind of echo a big issue we have to help people out in our society with. Dr. Leedia, Claudia's got a question here. She asks, is angular colitis also related to hormones, and how do you treat it?
So estrogen, that sudden estrogen increase. So during menstrual cycles, especially women on birth control, they undergo angular colitis a little more because of that constant influx of estrogen. How do I treat it? I can't tell a patient to get off of their birth control, or, I just we use a lot of ozone in our office, ozonated water. We rinse with that. I'm very into the homeopathic treatment. We up their hygiene recall schedule, bringing them back if it's painful. We work with a pharmacy that does a quadrants that makes it less painful for them to pick up. But it's definitely, I'm finding a relationship between the estrogen and the colitis and canker sores as well.
Makes sense too when there's when we have shifts in hormones and thrush and fungal issues. They
Yes,
they really
Candida.
do. Yeah. So it's all connected, and we kind of see Candida and thrush infections as an infection as such, but really if you see them as depletion and how there is a fungal microbiome throughout the body, which is just we're only just starting to learn about these things,
Yeah,
and you can
yeah,
imagine how influential hormones are to this whole network through the body. It's just fascinating.
yeah.
A lot of people today, Dr. Leedia, are dealing with fertility issues. I'm hearing more and more people dealing with problems with fertility, or they're just delaying their pregnancy, so they're egg freezing and so forth, and then they're going through potential treatments if they can't conceive. How are you seeing these issues with your patients, and some of the correlations to what you see in the mouth?
Such a great question. And I just had a patient 2 weeks ago. I'm seeing her for her routine cleaning, and we go over medical history. And then she was bleeding like 3 times as much as normal. I've been seeing her for 3 years. And then I stopped in the middle of the cleaning, and I'm like, has anything changed with your hormones? She's like, no. I'm like, are you on birth control? Like she's like, no, but oh, we're starting IVF, my husband and I. I'm like, okay.
That's a big thing.
That's a big thing. So let's talk IVF. I mean, she's undergoing a heavy influx of estrogen and progesterone and injection after injection and pill after pill. And she was in the she was in the preparation for the egg retrieval phase. So with IVF, you need to retrieve the eggs, fertilize them, and then implant them. And during all of that, that is a lot of hormones that gets injected in a woman's body. And so we got to talking, and we were talking. So I have her on right now. She's going every month. I'm going to see her until they need to retrieve the eggs. And after successful retrieval, I'm going to see her again. So I cater the recall schedules for these women. There's also women that are going through IUIs. One of my best friends, she went through that. Again, they're getting injected with so much hormones. That's other than the hormones that are already in their body. The estrogen is like destroying their gums, literally, if they're not coming in very often. And then the mouth gets acidic. And then there's also a very psychological component with people trying to conceive and are unable to conceive naturally. It's a financial burden, and it's a psychological burden on the man and woman, or the couple, on the couple trying to conceive. So that stress also causes more inflammation in the mouth that I'm seeing. So huge oral implications with fertility issues. And also, if they don't take care of their gum disease before, the gingivitis goes to periodontitis, that's passed on to the baby. And it actually has been found to increase the risk of potential rejection of the embryo, and it's transferred because if you have a lot of bacteria in your mouth, it can cause bacteremia, and that can cause increased your immune system to upregulate. And when it's upregulating, it's fighting, and it can cause the fight towards the implanted embryo. And you want the embryo to stick so you can have a successful pregnancy.
That makes total sense that there really should be, thorough dental screening before undertaking any of this treatment, because,
Yes.
as you said, it's a huge stress on, both the, potential mother and father, both financially, and then there's a lot of pressure too. If something doesn't take, it's like you've failed, and there is this psychological component to it, isn't it? And if you're undertaking that kind of treatment, you obviously want to start a family, and then there really is this idea that you're at the end of the road in terms of this is your last chance. So I think that's a really good point, and that if there was more support in how to kind of make healthier transitions, or how to kind of facilitate this better, it really would maybe even just take the stress down that could assist these kind of situations.
100%. And I want to make a point that a lot of people who undergo IVF, you're very lucky if you conceive on the first round. I know people who have gone through 7 to 8 rounds of IVF. So if you can imagine that, hormones being given, egg retrieval, reimplantation, more hormones being given, that 7 times, the amount of stress on your mouth is huge from a hormonal perspective and from a psychological perspective. And then they end up with really, really huge issues in their mouth. And that's another burden after. So, and then like I was saying earlier, also a lot of women are getting pregnant later in life, or they're waiting to have babies. So I have a lot of friends that are freezing their eggs, and I see them going through this. There is a lot of like tons of estrogen and progesterone injections while they're freezing their eggs. So there we go, more gingivitis, more swelling, and more turmoil in their mouth. And it can be reversible if it's in check at the very beginning. Or with IVF and IUI and egg freezing, these are all planned. So part of the plan should be a dental clearance. Like we do a lot of dental clearances for heart transplants, lung transplants here at Cedars-Sinai. Why do we do that for all the transplant patients and not our pregnancy patients? It should be the same, because it's the same in essence. You're something else is growing inside your body. So
Absolutely, and it'd be great to get there, right, like 6 to 12 months before,
yes,
before conception, right? So we can really get in front of all these issues. It's the disconnection there between medical and dental practitioners really it's glaring when you've got such a simple connection that you've just made there, that really doesn't happen, and no one really makes those connections, and then the patients just don't, and they have no support in that sense. So it really does show us how oral health is segmented in society, how we
yes,
put it to the side. Why aren't we looking into pregnant women's oral health that is clearly both in the literature and in what clinicians are seeing affected by making children? It just doesn't make sense that we're disconnecting this.
no,
Ha-
I fully agree. It's when you told me about like what I was seeing when I was pregnant, this I was seeing my gynecologist every single month or every 2 weeks towards the end of my pregnancy. And then after I had my baby, I see her at 6 weeks. And they're to clear you for like sex and just how you're feeling. Like they don't ask about how you're feeling mentally as much as they should, I feel. And I think part of them asking should be also about your oral health. Are your gums bleeding? Do you feel like you have bad breath? Has your oral biome changed? What are you eating? So I think there needs to be an in-depth discussion from the medical world with every single woman and pregnant. And then we haven't even covered menopause. Like it's so when I evaluate my women, I evaluate their number of hormonal surges in their life. So we have the puberty and the menstrual cycles, but like we said, not everybody goes through IVF, IUI, egg freezing, abortions, miscarriages. There's a lot of hormonal surges. And I'm noticing in my patients that the more hormonal surges that a woman is going through, especially when it's external hormones being put into the body, the worse their dental and oral health is.
Absolutely, and you brought up the whole the menopause side of things. This is something that I'm seeing a lot in terms of more and more women showing me their diagnosis for osteoporosis, and they're close to or have recently gone through menopause, and I just don't see that there was a consideration for hormonal what their hormonal status was in this period of their life. Take us through some the changes through menopause and what you're seeing in terms of your oral health, and what we think we can do to support these women.
So menopausal women, they have this drop in estrogen. Okay. And like I said at the very beginning, we have estrogen receptors in our gums, in our bones, and our salivary glands. That drop in estrogen. Now, before, when we had the estrogen hike, we got a lot of blood flow to the area, which led to gingivitis if left unchecked, and a lot more sensitivity to plaque. When the estrogen drops, there's a depletion of that blood. So I'm seeing things like atrophic gingivitis, where like just there's a collapse of the gingival tissue around the teeth. And like you said, there's osteoporosis, like there's an increase in osteoporosis. And because there's an increase in osteoporosis, our mouth is connected to the rest of our body. So osteoporosis, we have bone around our teeth as well, in our maxilla and our mandible. And we're noticing the heavier the osteoporosis, the more likely for tooth loss and heavy periodontal disease. And then couple that with the drop of estrogen with regards to the salivary glands. A lot of menopausal women suffer from xerostomia because of that drop in estrogen. And xerostomia means dry mouth. And I know you know, like dry mouth is one of the most detrimental thing for oral health, because we need our saliva. Our saliva is immunity, and we need it to clean off our teeth and to lubricate our mouth. When no saliva, the bad bacteria have a ball and they go crazy and they start eating away at our bones and at our teeth, causing a heavy amount of dental decay and a heavy amount of periodontal disease. So it's so interconnected. And then a lot of these women are depressed, and I'm finding a lot of people here in America are on antidepressants. And a lot of antidepressants also cause dry mouth. So the drop in estrogen, the increase in antidepressants, it's like a perfect storm for an oral disaster. And unfortunately, we're seeing a lot of that. But like you said, like you asked me what can be done about that. It's a lot of education, a lot of awareness. And it's a case by case depending on the woman and what she has.
Yeah, that's right. It really is. And when I see the diagnosis of osteoporosis, and obviously we're looking at their dental examination and their bones, of their jawbones, it's just, again, crazy to me that we're not considering these things in tandem. It's that they've got bone loss in some of the biggest bones in the body, their hips or their lumbar spine, and we're not considering the jaw. It's just, how can we not see this process as being a similar and very likely beginning in the mouth, where we have this connection between bacteria and how our body is metabolizing bone. And so the connection between hormones and the skeletal system is so clear, yet we just don't make it. It's crazy to me.
And also your TMJ, like a lot of menopausal women, that drop in estrogen heavily impacts their joint. And then, and burning mouth syndrome as well. A lot of menopausal women, I saw like 3 in the past 2 months with like burning mouth syndrome. And I started educating about vitamin B12 and lubrication. And there's a lot of oral changes that happen because of that drop in estrogen. So there needs to be a very heavy preventive approach, and approach filled with awareness, or literally a woman starts losing a tooth after another. And I'd like to die with a full set of teeth. And I'd like for every, but yeah.
Well, I'm sure you will. And there's another little question here that kind of comes in midlife. So Devo asks, what causes bone loss in the mouth in a 40-year-old?
So that's pretty much uncontrolled gingivitis that has traveled to the bone. So we need to make sure that our periodontal ligament, our gums are healthy. And for them to be healthy, they need to be cleaned and in check at all times. At a 40-year-old, sometimes you're premenopausal as a 40-year-old. And I'd like to ask this 40-year-old, like, how many hormonal surges has she had in her body? And I bet you anything she's had quite a few, not just your regular menstrual cycle. I wonder how many pregnancies she's had. So it's pretty much additive of that entire conversation that we've been having. You go through puberty, your menstrual cycle, who knows, any fertility treatment, and then pregnancies, all that constant estrogen, progesterone, rhinulin, tooth movement, external stress, grinding, clenching, that can all cause bone loss.
So you'd potentially be counting, 4, 5, maybe 6 hormonal surges. Yeah, and so in a 40-year-old, that's an easy it's an easy accumulation, isn't it?
Yes, very easy, extremely easy, especially in today's world right now. Like, I mean, I've had 2 pregnancies, so 2 major hormonal surgeries and the menstrual cycle. And that's pretty significant. I haven't taken any birth control, but for women who've taken birth control, I'd like to ask her if she's taken birth control. They're finding that if you take birth control for 1.5 to 2 years, that's when you start getting irreversible periodontal issues. So I always ask about the duration of birth control. And there are women who are on birth control for like over 5 or 10 years. That is a significant amount of influx of sex hormones being put into your body every day or every week, depending on the type of birth control that you're on.
That's not an uncommon duration, is it? 5 to 10 years.
No,
I think at least 5 years is quite common.
Yeah,
And
I remember when I started having a little bit of acne during when I was going through and my doctor wanted to put me on birth control. It's just like the thing that you just do. Had I gone on that, I would have been on birth control for like 20 years. Like that's a really, really long time. So I'd like to shed light for our medical practitioners to think about it before they put women on birth control and discuss other options. And if they need to, at least educate them that, hey, you need to go visit your dentist, especially in the first year after women start birth control. Their gingivitis is haywire. And that left uncontrollable becomes periodontitis and travels to their bone.
The theme of having a better connected conversation between medical practitioners, keeps coming up and up and up.
Yeah.
And, it really does show how, patients can fall through the cracks. But you also mentioned that, early in your career, you did shift the way you practiced and how, your view of the world changed, how you began to maybe upskill, how, the things you did in your practice, moving to a more functional biological way. Can you describe this change? Like, what was it? What were you doing before, and how did this change into your present day practice, and how you see this interfacing with a more fluid and inclusive medical system?
So I went to UCLA for dental school. It's a great dental school. I love my school. But like I said, with conventional dentistry, it's very much your tooth. Like I don't see Stephen Lin. I see just his mouth, and I want to, there's a cavity. Let me fix it. And that's it. Bye. Take care. And I was practicing that for a little while. But when I went to Saudi and I was treating all these women, I was like, there's got to be a better, I'm fixing all these teeth, but are these teeth going to stay fixed? I started thinking that, is my work going to last for 5, 10, 15, 20, hopefully a lifetime? And I started thinking about it, but it wasn't until that my daughter got sick and she started mouth breathing. And that's when I started digging deep and shifting my entire cycle. We dropped insurances from our practice because insurances want to dictate you how you practice. And you need to be upselling to your patients, and you can only have 2 dental cleanings a year. And I started noticing people need more than 2 cleanings a year. You don't need x-rays all the time. If it's a clean mouth, you don't need an x-ray. So I started getting a lot into biological dentistry, and I'm with the IAA BDM right now. And it's a much more soulful existence and practice for me as a professional, not only as a professional, but also as a mother, because that's how I'd want my daughters to be treated, as a whole body. Because I really believe that if you don't have a healthy mouth, there's no way you can have a healthy body. I don't care what supplements you're taking, how much you work out, what a 6-pack you have. If your mouth isn't healthy, your body cannot be healthy. It's a reflection of your gut and your entire body. So that's what shifted me. It's my daughter's sickness. So that was 4 years ago.
Absolutely. And it sounds like that you're having much more meaningful connections with your patients, and that moment when you explain that link, it's like the lights come on. You did mention the word awakening earlier in the talk, and so it's like there's this moment where all the lights come on, and all of a sudden we've been open to this world. And this happens for practitioners as well, right?
Yeah.
That you're not you're not discounting things that you were taught in dental school.
No.
You're saying that there are other ways to think about it and to apply it in ways that helps the whole human being that's walking through your door. And so it really is this philosophy that practitioners can take on, and also to kind of understand and acknowledge that we don't know everything. We really do not know everything. And in this whole hormone space, there's going to be an explosion of knowledge in the next, assume in the next probably 3 years.
We do.
And so we're going to see, practitioners who are open to this really start to, apply these principles in the practice in a broader sense. And so the there's a real balance in healthcare where we have to kind of stay to our protocols and our research and everything, but there's also this human element that I just think that is so critical to solving problems that aren't easy in patients. Hormonal issues and hormonal processes just aren't easy for patients, are they?
No, no. It's like you said something that really hit the nail on the head, Dr. Lin. It's that human approach. It's like looking in a person's eyes and seeing a person, not just a mouth, not a crown, not SRP on all four quads, or is this covered or not? It's really seeing person X and seeing how that problem connects to their whole body. And it's a much soulful way of practicing. And I think that's what I, it was like my soul shifted when I saw my daughter almost die. Like my world stopped. Like nothing mattered at all. And then when she started going through these physiological changes, and I was seeing like darkness under her eyes because of her mouth breathing, and we never connected the dots. It wasn't until like 6 months to a year after I'm like, oh my God. And then I wasn't taught that in dental school. No one told us about mouth breathing. As amazing of a school UCLA is, and I love it and everything, but they didn't really focus on that because we just focused on teeth. But I can fix all the teeth in the world. If a patient is mouth breathing, that's all going to go down the drain if they don't fix that. Or if they're constantly eating peanut butter and jelly, crustacean. Like I had a patient yesterday, that's all they snack on. These crustables that they get from their school. That's like, even if they have the best hygiene in the world, like dentists want to think like, okay, it's just brushing and flossing, but it isn't. That's just a portion of the pie. There's the supplements, the vitamins, the fat soluble vitamins that you go into depth in, which is so amazing. And the breathing, the mouth posture, all of that is very important. And it wasn't until I started like you said, awakening and seeing everything. And I'm like, wow, I don't want to fix your tooth yet. Let's fix everything else. And then I'll fix your tooth and that tooth will stay fixed.
That's right, and dental work is very finicky and difficult. So that if you have unstable foundations, it really does affect the outcomes. And so, like you say, unless you get to the the real underlying issues that a patient is suffering, the outcomes really just do not play out in the real world. And I think a lot of people blame some of the dental work they've had, but really, there's a lot of underlying health issues that makes dental practice very difficult to kind of land in a patient's mouth. And so once we start seeing this, it does hopefully lead to better outcomes for everyone, both the dentist, and the patient as a whole. Your brother's a dentist too. How has kind of your relationship? You've got two dentist brothers.
Yes, they're both.
How's your relationship with them and this whole process that you've gone? How's that gone down?
I mean, I'm so lucky that they're very supportive. We're very close knit 3 siblings, so I'm very grateful for that. They're very supportive. I think there was a little bit of skepticism at first when like I'm shifting before I was doing fluoride treatments on everybody, and now I'm like, no, so that there's a shift there. It's a program. We've been programmed in school and in practice. But I think they're just so supportive, and they're seeing a different soul and energy come into our office. And I'm booked out for like almost 3 months now with soulful patients that really want to get to the root cause of things and fix things and keep them fixed. They're coming asking for whole body dentistry. And that makes my life so much easier. So I'm working with my older brother today. I just finished patients about an hour before I came on with you. But we're very, very close. And he's like, what a shift. It's just incredible. So he's going to be placing all our zirconia implants. And I feel like he's starting to get on board and seeing that. So it's amazing. I'm just so lucky that they're so supportive. I do have some friends, a lot of dental friends. I feel like there's a lot of skepticism there too, because it's so new that's talked about. Like, this isn't new knowledge that we're sharing together today. It's just, I guess it's not sexy enough for like people to be talking about it all the time. So, but I'm going to make it a mission, because I think that once women's dental health is a thing and it's worldwide, then we're going to see a lot less infants and children undergoing dental disease. And there's 530 million children every year suffering from dental decay. And it's a number one reason for missed school days in the United States. And that is completely avoidable. But we got to start with the mothers.
Yeah, absolutely. And I really want to emphasize that point, because I love that part of your mission, that I think if we really build a focus in our society around women's dental health and how the hormonal and the birthing process does affect our dental and then subsequently our systemic health, that is a big pillar to improving a lot of the health issues we suffer in society, including having healthy parents means healthy kids as well. So I love that that's your mission, and let's round that off. Sum that up for us one more time from Dr. Leedia.
My mission is to revolutionize women's dental health and make it a thing. Make it a thing that's studied and taught and part of gynecological visits between our medical professionals and the dental professionals, because once that's done and each mother and even woman, whether a mother or not, has the full knowledge of what all of these sex hormones are having on her, like proper informed consent when you give birth control, or proper informed consent when you are having a baby or going through IVF, and having a schedule to keep disease in check, that is going to be the first portal to solving the amount of dental disease that we see in our world. Half of the world suffer from dental disease, and that it's a preventable disease. It's acidity, alkalinity, and getting to the basis of that's what I want to get to, so that especially our children don't suffer and our women don't suffer.
Absolutely, I agree. And I agree that can be a very, very powerful shortcut to solving some of the issues that we're seeing today. Dr. Leedia, you mentioned you're part of an organization that thinks like this. Can you let people know, where people can find like-minded dentists, where they can find yourself, and any work that's coming up on the horizon for you?
Sure. So there's International Academy of Biological Dentists, so IABDM. And also the IAOMT, International Academy. I'm not part of that one, but you can find IAOMT. Please look it up. Yeah. I don't know the exact what it stands for, but there you can find like-minded dentists that really look at root cause and whole body dentistry. It's whole body dentistry. And for me, I mean, I'm just going to continue on my mission. I'm so grateful that you invited me to be on your platform. It's these lives, and I've had some amazing lives in the past 3 to 4 months that really have shifted my practice and has made it boom in ways that I never expected. But just staying on my mission and keep educating and keep talking about these hormones and just how it links to our next generation. Like we can fix, and we didn't even talk about like cancer, chemo, like there is so much, like we can do a second session soon, but I'm treating somebody who's getting all these hormones and chemo at the same time. And her mouth is just, it's a mess. But it's under control because I'm literally seeing her every 2 to 4 weeks to keep things in check. So I'm going to keep going in this and, just keep spreading my mission.
And what's the name of your practice and your socials so people can find you?
Sure. R Dental Group is my practice. Riman is my last name, so the letter R Dental Group. And I'm most active on Instagram, Dr. Leedia, at Dr. Leedia.
Well, the message is very powerful, and I think it's one that's going to be at the front because there's a lot of dentists out there, as you say, practicing biological functional dentistry, focusing on women's health, though. There's not many out there. So I think that this needs to be one that you become a leader in, which you
Thank you.
will.
Thank
And thank you so much for sharing your story and all your work, because it's been a pleasure. And I really think this is something that can change people's lives. So thank you so much, Dr. Leedia Riman. And we'll definitely have to do this again and dive deeper into the world of hormones and oral health.
Sure. Thank you for having me. It's a pleasure.
My pleasure. We'll talk soon.